WFM 91.7.
A beautiful morning to you. Thank you so much for staying with us right here and of course joining us on Women Radio WFM 91.7. This is Nigeria's first radio station for women and their families. I hope you're doing well today. I hope you're feeling great today. I hope that you're feeling all round healthy. All right. So because every day we come here, we talk to you about your health, different aspects of your health. I just hope that you're putting it into practice and you are indeed living by it. Okay. Because if not, me, I will come find you. All right, so this is about 5 minutes after 10. My name is Rose Yusuf Kaiser. You are welcome to Radio Doctor. Radio Doctor is your free health consultation program where real doctors advise real people. Radio Doctor is Nigeria's first specialized health program where medical doctors consult for free and advise on radio right here on Women Radio WFM 91.7. Radio Doctor comes to you from 10 a.m. Mondays through Fridays. So today, Radio Doctor is on women's health. Yesterday was on children's health. Today we're going to dwell on women's health, and it is supported by ACT Foundation. All right, that Women's Health Today on Radio Doctor is supported by ACT Foundation. All right, so today on the program we have Dr. Collins Aboloje. He's an assistant medical director and a fertility physician at St. Ives Specialist Hospital. Good morning, Dr. Aboloje. Thank you very much for joining us today on Radio Doctor.
Good morning, Rose. Thank you for having me once again.
All right, so how have you been? How has, seeing patients, how have you been dealing with patients, all of that? Just give us small gists. Maybe we know how you do.
Well, I've been okay. Basically going about my regular activities or my routine activities on a daily basis. So, and the patients keep coming because these conditions actually are not going anywhere anytime soon. So basically, you find one person that has been able to conquer all of these, and then you find somebody else that has been befallen by it.
Yeah.
So basically, we just have to do what we have to do.
And we get to appreciate you all for all the good work you do for us as our doctors. Yeah. All right, Dr. Aboloje, thank you once again for joining us today on Women's Health right here on Women Radio WFM 91.7. All right, so to be a part of the program today, you can dial 07000 917 917. Send a text or a WhatsApp message to 070 317 56537. You can send in your contributions to our social media platforms, Facebook, Instagram, X, and YouTube at WFM 917. You can log on to our website, www.wfm917.com, or you can download our mobile app, WFM 917, and then you get to listen to us from any part of the world. Yes, we will not leave you alone, and we don't want you to leave us alone, so listen to us from any parts of the world. All right, so today on Radio Doctor, Dr. Collins Aboloje will be talking to us this morning on tubal factor infertility. Yes, you heard me, tubal factor infertility. That's our topic for today. All right, and like I said, you can go ahead and call us up on 07000 917 917. Send a text to 070 317 56537. All right, so let's head on to talk about the cervical factor infertility. I beg your pardon, it's cervical factor infertility that we'll be concentrating on today. All right, so Dr. Aboloje, let's start up with this. What is cervical factor infertility?
Okay, cervical factor infertility is infertility that arises as a result of problems with the cervix. Let's just put that simple. Let's just make it simple. So now the cervix, first of all, a lot of women, a lot of us actually do not even know the parts of the body, first of all. Now, also by extension, some women also do not even know the parts of their reproductive system. Okay, so basically just to make this very easy, I'll just go through it and just to enlighten us a little bit. So basically the womb, the reproductive tract of a woman consists of course, the vagina, the cervix, which is the lower portion of the uterus. Okay, it acts as a gateway between the uterus and the vagina. and it has some functions, which of course I'll be speaking about shortly. And of course, we have the womb in itself, where the baby stays and grows until the baby is delivered. And then you have the tubes and then the ovaries. So basically, when there is a problem with the cervix, which acts as that gateway between the uterus and the vagina, when there's a problem with that cervix, it can go on to cause infertility. So that is cervical factor infertility.
All right, thank you so much, Doctor, for letting us know what cervical factor infertility is. All right, so this is Women's Health on Radio Doctor, and is supported by ACT Foundation, and this is 10 minutes after 10, and the doctor is here, and of course he is advising and consulting on cervical factor infertility. What are your concerns? What are your questions this morning? Go ahead, call us up. Let's get to hear from you this morning. The number to call is 07000 917 917. Let's get to hear your questions. There's your concern, maybe for somebody you know, maybe for a friend or family member or any, buddy you know that's going through this. Hello, good morning.
Hello, good morning, ma. How are you doing?
I'm fine, thank you. How are you too?
Very well, ma.
All right, what's your name? Where are you calling from?
My name is Gloria Ibuge. I'm calling from Pakoro, Mowi, Ogun State.
All right, Pakoro, go ahead, Gloria. Let's hear you.
All right. Doctor, good morning, sir.
Good morning. Good morning, ma'am.
Yes, sir. I have a daughter who is 20 years old plus now. She saw her first menstrual period on her 13th birthday. And ever since that time, the period has been off and on. We have actually gone to the hospital to lay our complaints. They gave her a contraceptive that she should use the opposite side. Well, since July this year, she has not seen, June, July, she has not seen that period. So I don't know if there's any other thing we can do.
All right, Gloria. Okay, go ahead, doctor.
Okay, yes, so let me understand this. You said you have a daughter that is 22, right?
She's 20 right
20.
now, going 21.
She's 20, going to 21. So she's been having menstrual irregularities. Right?
Yeah.
Okay. So she has been giving contraceptives, and was there any time where it became normal? Was there any time where the menstrual flow, the regularity was where it was regular? Was there any period it was regular? Was there any time it was regular?
It will just be regular, like 3 months, and after that it will stop.
So she will see it for a couple of months, and then it will stop and disappears again for a while.
Yes, sir.
Okay. So now there are different causes of that. Okay. First off.
All right, Doctor. Apology. Just before you get to answer, Gloria. Gloria, I would love to know from you. Is this? Have you been listening to Radio Doctor regularly?
Yes, I have.
Okay. All right. And this program has impacted you, a lot.
Yes, very well.
All right. So, could you send me a text to our text number so that we'll get in touch with you? Maybe if you need further referrals or something.
All right, ma.
All right. So I will call out the number during the course of the program. Please send me a text, please. Okay. So maybe you can continue this conversation just in case it's not, you don't get all your answers here.
Okay.
All right. Thank you very much, Gloria. The doctor will attend to you. All right, Dr. Abolaji, please go ahead.
Okay, so basically, for a young girl who is experiencing menstrual irregularities, there are different causes. Now, one of the causes of menstrual irregularity, of course, in a very young lady, who, of course, sometimes would respond to the OCP, which was the contraceptive pills that were given to regularize her menstrual cycle. Okay, and then after she goes off it, then she goes back to status quo. Okay, the commonest cause for them actually is polycystic ovarian syndrome. Okay, polycystic ovarian syndrome is a condition where, of course, on the long run, okay, there are different symptoms that encompasses a lot of symptoms where you see asceticism, menstrual irregularities. Now sometimes delays, sometimes she sees it, sometimes she doesn't see it, and acne. Okay, so this is very, very common, especially, in fact, in these days, we've got to see, we are actually seeing a lot of young women experiencing polycystic ovarian syndrome, and sometimes it can actually, not even sometimes, it can actually be problematic and emotionally draining for most young women. So another cause can be that, now the thing is, what we've also seen, women at extremes of age. Now, when I mean by extremes of age in this sense is that a lady who just started seeing her menses, chances are excellent that in the first couple of years that she started seeing menses, she would experience some menstrual irregularities. Most likely maybe due to the body just trying to acclimatize to the new ongoing process, which is part of her reproductive normal reproductive process that has to go on for her, like as being a woman. While for other women, it could be at women that are very close to menopause. Okay, so basically they start to experience menstrual irregularities. So this is just to state it out there that, of course, women at these ages, okay, they would experience menstrual irregularities. But for your daughter, being that she's 20, going to 21. Chances are excellent it could be a polycystic ovarian syndrome case. Okay, but I am not giving that diagnosis yet because tests have not been conducted. So usually when she goes over to the hospital, rather than just give her OCPs and then she goes and comes back again and all of that, further investigations should be done to actually rule out polycystic ovarian syndrome. Okay, just to be very, very sure. But yes, my suspicion, I have a very high suspicion for polycystic ovarian syndrome because of that age. It's just specified.
Okay. All right. Thank you very much, Dr. Abolaji. So, Gloria, if you're listening to me, send a text to 070 317 56537. 070 317 56537. Please send a text to that number, and I would get in touch with you much later and we can pick things up from there. Okay, thank you very much, Gloria, for calling. And for all of you listening to me right now, you can call me up on 07000 917 917. I have Dr. Collins Abolaji with me this morning, and of course we're talking about cervical factor infertility. But if you have questions, if you have concerns that you would want the doctor to address, is Women's Health today on Women Radio Doctor. Please do well to call in. Let's get to hear you. Would love to hear you. The doctor is here to advise and consult for free. All right, Gloria, I hope that you've definitely taken note of that, and I'm hoping to get your text message too. Hello, good morning. Hi, good morning. All right, okay. I want to believe that the mom is somewhere around there. Maybe she just made the baby to call and hoping she would come around to talk. But let's just head on to it now. Dr. Abolaji, you've told us about cervical factor infertility. Now let's understand how this actually, plays a role in fertility. So just take us through that, because you've told us what this is. Now I want you to spend a little bit of time so that we get to understand and we get to follow this up, because when we get to understand this, then we get to know how serious this could be, or how serious the process is in terms of fertility.
So cervical factor infertility actually affects about 5% of the infertile couples. About 5% of them that come over to the hospital seeking intervention for infertility, they're actually experiencing cervical factor infertility. Now, why is the cervix so important? Like I said earlier, it acts as a gateway, okay, between the womb and the vagina. So basically, it acts as an outlet, okay, first of all, for menstrual bleed from the uterus. So when a woman starts to see menses, basically you're able to see it, you're able to find it in your pad, because the cervix is open, so it allows the flow of that blood, that menstruum, from the womb into the vagina and onto the pad. Okay, so that is one. Number two, the cervix, by reason of its parts, okay, the cervix actually has two parts. That's the ecto and the endocervix. Okay. Now the endocervix simply means the inner portion of the cervix, and the ectocervix means the part that you can see on the outside in the vagina. So that endocervix actually produces cervical mucus. Okay, this mucus itself is produced by those cervical cells. There are some endocervical glands that are present inside of that inner space of the cervix. So basically, they produce mucus. The mucus is very important as regards trying to get pregnant. Okay, they play a very pivotal role in the sense that they allow at a particular time of the menstrual cycle. Okay, with respect to the hormone that is being produced, which is estrogens, it could result in this mucus taking a particular consistency, having a particular consistency, and at another time, and at a later time in the menstrual cycle, okay, after the woman has ovulated, the cervical mucus also takes another consistency. Okay, it takes another. By consistency, we mean like a form. Okay, so basically, at some point in the very first half of the menstrual, especially when it's very, very close, to the ovulation time of the woman, okay, the cervical mucus, that mucus that is produced, becomes very thin and very voluminous, so to say. So we call it copious. We usually say copious in our medical language. So basically, it becomes very copious, okay, by reason of the estrogen that has been produced that increases the water and the salt content present inside of that mucus. So if it becomes very thin like that, it allows for easy passage of the sperms, okay, for their onward journey into the womb and down to the tubes. So when the woman ovulates, okay, the egg comes into the tube, of course. If she meets on that particular day, by reason of the copious mucus that is being produced, the sperms that are ejaculated, the semen rather, is ejaculated into the vagina. The sperms in there, okay, they more like use that cervical mucus as a passage. It just gives them a very comfortable environment and comfortable push, okay, for them to be able to pass through the cervix and go into the tubes for fertilization of the egg. So basically, that is one function of the cervix, which of course is very important to note. So, and of course, the cervix also acts as a channel through which a baby is delivered. So when a woman gets pregnant, when she starts to contract, when the baby is term and she starts to contract, she goes into labor, she starts to contract, the cervix will dilate. It has the capacity to stretch open, okay, as wide, even wider than 10 centimeters in your finger, in the span of two fingers. You understand? This will allow for the passage of the baby, easy passage of the baby through. So basically, these are the functions of the cervix.
Okay.
So now, but the most important function to note is that production of cervical mucus, okay, because this is what really allows for natural conception. Because if the sperms cannot pass through the cervix, okay, more like, of course, they won't be able to get to the tubes to fertilize any egg that is present. So yeah, that is for that. Okay. So without wasting more time, I think I will just, if you permit me, I can just go straight to just talking about what the causes of cervical infertility can be, before the next caller calls in.
All right, so let me just give out the number again before you go on to that. 07000 917 917 is a number to call, and lay your concerns here, ask your questions. The doctor is here to consult and advise for free, on Radio Doctor. That's what we do on the program Radio Doctor on Women Radio WFM 91.7. So 07000 917 917 is a number to call in. Send me a text or a WhatsApp message on 070 317 56537. Gloria, if you're listening, I'm still expecting a text from you. All right, Dr. Boleje, please go on. Let's get to know the common causes of cervical factor infertility. All right, we have a call. I'm sorry, doctor. Do you want to call me back? 07000 917 917. Please go ahead.
Okay, so some of the causes to note here. Number one is developmental anomalies. So usually, so for some women, they're actually born with an abnormal cervix, so to say, maybe or what we call an underdeveloped cervix. Okay, so for some people, they have what we call cervical hypoplasia. So basically, the cervix didn't really develop the way it should develop. So it might look even smaller than the way it should be. Okay, for some people, the cervix in fact, the cervix is even absent, even though it is a little bit rare. But of course, there are some people that don't even have that cervix. They don't even have cervix at all. For other causes include infections. People who have had infections, chlamydia, trichomonas, infections. These can also, of course, result in cervical factor infertility. And then for others, it could be trauma from previous surgeries that they had, maybe for some reason they had trauma which resulted in the damage of the cervix. Okay, and then for others, tumors. Now, usually we categorize them as tumors. Now, in the sense that for some women, while some women can have uterine fibroid, some other women can have cervical fibroid. Yes, the fibroid is in the cervix and not in the womb. It is in the cervix.
Cervix,
so
okay.
It will be acting as a form of mechanical obstruction inside of the cervix. Okay, for some other people, they could have what we call a polyp. A polyp is like a fleshy growth. It's an abnormal fleshy growth that grows from.
All right,
just from the cervix, or could
just a minute, doctor.
It can grow from inside of the womb.
All right, just a minute. Hello, good morning. Hello, good morning. You're connected. Can you hear me? All right, do you want to call me back? I'm not sure the caller was able to hear me. 07000 917 917. All right, Dr. Abolaje, we're talking about the polyp.
Yes. So a polyp is an abnormal fleshy growth that grows from either from the inside of the womb, okay, from the endometrial cavity, or even from the cervical, from the endocervical canal itself. Okay, so basically, a polyp itself can cause problems, okay, because it bleeds. It could just bleed spontaneously, okay, or it could even result in contact bleed, as the case might be. For some other people, is that they are having what we call cervical stenosis. This stenosis is what has resulted in the cervical in the infertility that they're experiencing. Now, there are different causes of cervical stenosis in itself, which of course I will run through as we continue in this discussion. For some other people, the reason why they're not getting pregnant is because they're having low estrogen level, and this hypoestrogenism will result in a poor cervical mucus. And of course, I already elaborated on this, the need, okay, the benefits of the cervical mucus, okay. And for others, the medications that they have used in a bid to try to get pregnant, medications like Clomid and even some other medications which are progestogens, especially for people that are using it as a form of contraceptions, or for other treatment of other medical conditions. It can result in, of course, a poor cervical mucus. And then lastly, anti-sperm antibodies. Anti-sperm antibodies, I don't know, for some people they might be hearing it for the very first time, but actually they are antibodies which are defense systems that are produced against the sperm of a man. Okay, so women can produce these anti-sperm bodies targeted at their husband's sperm. Okay, or even in men themselves, they can produce anti-sperm antibodies in their own body, maybe by reason of procedures that they've had done in the past.
All right, thank you so much. All right, thank you so much, Dr. Abolaje, for giving us the causes of cervical factor infertility this morning. This is 28 minutes after 10, and of course, this is the program Radio Doctor, your free health consultation program where real doctors advise real people, which is Nigeria's first specialized health program where medical doctors consult for free and advise on a radio. That's Women Radio WFM 91.7. Hello, good morning. All right, so let's try to see what we can do on that, because we're having calls coming in, but we can't seem to, or rather maybe they can't seem to hear me. So we'll try to see what we can do on that. But in the meantime, we have Dr. Collins Abolaje with us, an assistant medical director and fertility physician at St. Ives Specialist Hospital. My name is Rose Yusuf Kaiser, and of course, this is Radio Doctor. And today on Radio Doctor, we are concentrating on women's health, all right, and it is supported by ACT Foundation. All right, and Dr. Abolaje is talking today and advising on cervical factor infertility. But if you have concerns, if you have questions you would want to ask Dr. Abolaje, please go ahead. Concerning women's health, please go ahead and call us up. Let's get to hear from you. Send me a text or a WhatsApp message to 070 317-565-37. Okay, let's get to hear your thoughts this morning. All right, so we have a message here, a WhatsApp message, and it says that, good morning, Dr. Collins and Rose. Good morning to you too. I have been having series of miscarriages since my marriage of 10 years. Please, what do I do? I am 41 years old. And, okay, yes, that's just, she said, please, I need help, seriously. She's 41 years old and she's been having series of miscarriages since our marriage of 10 years right now. Dr. Collins, this is Eunice pleaded for help, seriously.
Okay. So if she's having if the person is having recurrent miscarriages, okay, recurrent miscarriages, they actually have different causes. Okay, first of all, usually when a woman starts experiencing miscarriages, okay, we usually attribute the etiology, the cause, okay, as to when, we actually try to correlate it with the date, with the time frame in which she always develops that experiences that miscarriages. If she's having the miscarriages in the first trimester, okay, usually problems, or maybe if it's early in the first trimester, usually problems are usually related to either the quality of the egg or the quality of the sperm that resulted in that pregnancy. If she's having the miscarriages in the second trimester, chances are excellent it could be a cervical problem. Okay? Yes, it could be that maybe the cervix is incompetent, and of course there are still some other causes of recurrent miscarriages. Okay, another thing to also note is, of course, the if there are anatomical pathologies, if there are anatomical malformations of the uterus. Okay, this can also result in miscarriages. And then, of course, autoimmune conditions, antiphospholipid syndromes, and thrombophilias, and the rest. These are also causes of recurrent miscarriages. So now, at this particular age, okay, from the age of 30 generally, the eggs, both the quantity of the eggs start to reduce. So after the woman has crossed the age, okay, of 35, okay, usually the rate of reduction in the egg quantity and in the quality, okay, increases. So the reason why I'm saying this is because time is of the essence for this woman. Since she's 41, it is very expedient and it's very important that she visits the hospital to get properly evaluated to be sure of what the cause of that miscarriage or what the causes of the miscarriages have been. And of course, the appropriate measure should be instituted. Now, at this stage, of course, I would advise her that she heads to the hospital, gets proper evaluation, and of course, be very, very open to whatever intervention that will be preferred to her. Especially at this case, of course, I would want to suggest to her that she heads over to the hospital to have IVF done.
Okay.
Yes, this is going to be the best decision for her, especially at this age of 41. Eggs are quickly diminishing, so it's very important she gets there. And of course, she will be counseled on the appropriate IVF for by women of her age.
Okay.
Very important to get there.
All right.
As possible.
All right. Thank you so much, Dr. Abolaji, for giving Eunice your honest advice on her case. Hello. Good morning.
Yeah, good morning.
Good morning. What's your name? Where are you calling from?
Yes, I'm Yusuf Olamile from Lagos.
All right, Yusuf. Thank you very much for calling. Yusuf, are you a regular listener to Radio Doctor for Mental Health?
Yes, I'm one of the founding member of this program.
Wow!
And even your station, yes.
Oh wow!
Yes,
oh, wow.
I can mention a lot of doctors that have gone and come.
All right, in that case, please, I would love you to send me a text message after this, okay, or a WhatsApp message.
All right.
All right.
Okay, I will do
please
that.
Go ahead.
So my question for the doctor is this: is it possible that there can be changes or incomplete DNA test, maybe that will bring doubts after the DNA test? Is it 100% assured that when one go for DNA test, the results will be 100% sure and there won't be any disparity? So I want him to enlighten me on that.
All right, Yusuf. Thank you very much. What part of Lagos are you calling me from?
Yes, I'm around the Alakuko side.
Alakuko. All right. Please don't forget to send me that text message so that we'll get in touch with you.
I will do that.
All right. Thank you very much.
Thank you.
Thank you.
You're welcome. Thank you.
All right, Dr. Abolaje, DNA testing has been everywhere on social media, of recent. So a lot of people are actually having double thoughts right now. So go ahead and answer yourself.
Okay, well, now, generally, I may not be able to give you a very perfect answer to this question because I'm not a geneticist.
Yeah.
But now, generally, the DNA test, okay, they have not been proven to give you 100%. Okay? Yes. But of course, with the extent of with the extent of research into this DNA technology and all of that, okay, they have been able to give you results that are around 90+%, okay, 90+% sensitive and specific. Okay, but to put it to 100%, at the moment it says that this is what it is, nah, nothing. But of course, 90%, 90+% of specificity and sensitivity actually accounts for a lot and accounts for much. So DNA results that are given to you, okay, they are expected to be trusted.
Okay.
They are trusted. You can actually trust them. Okay, so that's just what I can actually say at this moment.
All right.
But to dive deep into it, of course I can't. But of course I can tell you that for sure you can actually trust DNA results because they have such high level of sensitivity and specificity.
Okay. All right. Thank you very much, Dr. Abolaje, for that. 07000 917 917. Oh, we seem to have a lot of calls today, Dr. Abolaje. But let's head on. Hello, good morning.
Hello, good morning.
Hi, good morning. What's your name? Where are you calling from?
I'm Vera calling from.
You're Vera.
Vera.
Okay. All right, Vera from Ibafo. Are you a regular listener to Radio Doctor?
Yes.
Okay, great, Vera. So you will do me well by sending a text after this, so we'll get in touch with you.
All right,
go ahead, Vera, please.
I'm calling on behalf of my younger sister.
Okay.
She has been married like 2 years now without a child. So, she's having symptoms of pregnancy. The breast was full, every symptoms of pregnancy. But after 3 months, she started seeing a menstruation. We went to the hospital and the doctor said she was never pregnant. So I want to know the possibility of having the symptoms of pregnancy, and after 3 months, they said she was never pregnant and her breast was full. She was having symptoms of pregnancy.
All right, Vera, in that 3 months, did she do a test? Maybe a home test or,
Yes, she did scan and it showed positive.
It showed positive, and scan too showed that it was positive.
No, she did.
She didn't do a scan?
Yes.
She didn't do a scan within those 3 months?
Yeah, but she did pregnancy test.
All right. Now, how often did this happen? Was it just once it happened?
Yeah, just once. Yes.
Okay, and she's 2 years in marriage now.
Yes.
All right. Can we know how old she is so that would help the doctor?
She's 37.
37. All right, Vera. Please don't forget to send me that text. I will give her the number to send a text or a WhatsApp message.
All right. Okay.
All right. Thank you so much, Vera. Thank you. All right, Dr. Abolaje. You heard Vera.
Yeah.
Okay.
Okay. So now, by reason of the age of the woman, so I think she got married at the age of 35. So she's currently 37.
37, yeah.
And then she experienced this. Yeah. So now, when a pregnancy test is done, okay, the question now is, was it a urine test or a blood test? Now, the reason is because some urine tests, now they are sophisticated. This is not to downplay the home or urine test strips and all of that, but then there are some sophisticated ones, okay, and then there are others, okay. So just for me to use the word others, okay. So some of the others now, okay, in quotes, okay, sometimes they can actually give you a false positive, Yeah, we've had some of the cases of that instance, okay, where of course the woman had a false positive. So usually we do not really, we prefer, okay, I prefer, okay, that the woman does a blood pregnancy test, okay. If it is positive, blood test, if the blood test is positive, then the woman is actually pregnant. If the urine test is positive, I will still advise her to go for a blood test. Okay, because these urine strips have been proven to give false positives also, especially because maybe they are sensitive to some proteins that are present in the urines, and of course would also come out as, maybe I don't know if there will be some form of cross reaction and all of that. But then of course we've seen these cases, so it is better that the next time she feels that she's pregnant, she does a blood pregnancy test. Now, you see, she later went over to the hospital where she was told, I think 3 months after, where she was told that she
was never pregnant.
She was never pregnant. So the thing there is that the body also has a way of acting very funny. Okay, some persons can experience pregnancy-like symptoms even when they are ovulating or when they are about to ovulate at a particular time of their menstrual cycle. Okay, so it is not uncommon to find out that she also experienced all these pregnancy-like symptoms for like that long, and especially because the mind is already acclimatized to the fact that, okay, yeah, you are pregnant, so okay, even though she wasn't or suspectedly wasn't, okay, so she just keeps on developing and keeps on going with that permit me to use the word pseudo symptoms, okay, especially because it was later confirmed that she was never pregnant. So my advice for her, and that is what I would repeat again, is that the next time she feels that she's pregnant, she should get a blood pregnancy test done. Another thing that can also happen, even if she had done a blood pregnancy test and later went over to the hospital, 3 months is a long time. So if truly she got pregnant and the pregnancy resolved, okay, more like for people who have biochemical pregnancy, there are certain things called biochemical pregnancy where the woman actually got sort of pregnant, but then the pregnancy resolved even before it could start developing, before it could start developing into the advanced stage, or before it could even start developing even in that early phase. Okay, so usually these are called biochemical pregnancies. So maybe truly she got pregnant, but then it resolved. And at the end of the day, of course, going to the hospital 3 months afterwards, of course, every doctor will just be like, okay, yeah, truly you were never pregnant, because you must have maybe been already seen menses, the endometrium will be thin, you're doing a scan, you're not seeing a thickened endometrium, any sign of desensitization. So basically, of course, the right conclusion would be that this woman is not pregnant or was never pregnant.
Okay. All right. Thank you so much, Dr. Bolaji, for answering Vera there. So, Vera, I hope you understand better and you get to advise your sister better too. Please do also send me a text. So, Vera and Yusuf, Gloria, thank you very much. I've seen your text. Vera and Yusuf, please send a text to 070 317 56537. Send a text or a WhatsApp message, whichever you're comfortable with. 070 317 56537. Just do well to send a text message or a WhatsApp message to that number so that I would know it's you, and then we get to take up the conversations from there, right? Because we really, really love to hear from you how far so far Radio Doctor has impacted you since you have been listening. Hello, good morning.
Hello, good morning.
Hi, good morning. What's your, where are you calling from?
Yes, it's Mr. Yusuf Olamide Kwadede calling back from Lagos.
All right, Mr. Yusuf. Dr. Bolaji actually answered you.
Yes. I want to ask one question from the doctor again. I want to ask what is the cause of surgical procedure to case of human delivery when human are delivering? The rate of surgery is, but when it comes to animal, they don't normally go through procedure before they deliver. They deliver easy. So I want to ask, is it that we humans, we do tamper with nature? So what's the cause of that? So that's my question. Thank you.
All right, Mr. Yusuf, don't forget to send me a text. All right, Doctor, he is asking about the rates of surgery, CS, right now for women when they want to deliver, because now according to him, for animals they get to do this, without surgery, but for humans now, the rate at which we have CS is becoming more. So, what could be the cause, or why do we see a lot of CS being done?
Okay. So now, I don't think there's anything resulting in the increased incidence of cesarean delivery. Okay. The thing is that the moment a woman gets pregnant, okay, the pregnancy is actually a process. It has about 40 weeks. Okay, for that baby to develop before the baby is delivered. Okay, that's a long time. So things can actually happen on the way. Okay, in the course of that pregnancy, certain things can happen. The woman could have a high blood pressure, okay, that was formerly not there. Protein could start to appear in her urine, So all of these things, there are different interventions that have to take place for her, especially cesarean delivery, okay, especially cesarean section for a woman that already has preeclampsia, okay. So nobody really wants to put that woman to start pushing. Okay, to go through vaginal delivery. Okay, when she's got preeclampsia and all of that. So basically, the moment you see that is already a pathway. That is already something that actually signifies a pathway for that woman to have cesarean delivery done. So there's nothing really predisposing. There's nothing that has resulted in this increased cesarean delivery, but whatever is experienced in the course of this pregnancy. Now you find a woman who is having a breech pregnancy, okay? Of course, such a woman has to do cesarean delivery. You don't want to have to start, maybe the baby is having a transverse line and then you want to have this, you want to you want to tell the woman to push. How is that baby going to come out? A baby that is like transverse or oblique, how is the baby going to come out? Of course, so the baby has to do cesarean, the woman has to do cesarean delivery. Okay, or for some women that have cephalopelvic disproportion, CPD, basically meaning that the baby is bigger than the passage that it has to pass. That baby will not pass. It will prolong the delivery time. You will just suffer that woman for nothing. And at the end of the day, the woman will still have to go through that cesarean delivery. So to answer that question, sir, okay, nothing has increased the rate. It is just what happens during the course of the pregnancy, and there are a lot of causes. Okay, a lot of causes as to why a woman should have cesarean delivery, a few of which I already mentioned.
Okay. All right. Thank you so much, Dr. Abolaje. Thank you so much, Eunice. Gloria, I've seen your text. And then we have another question here. Now, I will just take this before we come to TT. Our time is fast spent. So, Dr. Abolaje, you just help us to see how we can answer these questions. I might not be able to take more calls again. Now, this one is coming from TT in Abeokuta. She says that, good morning, Dr. Abolaje. Dr. Abolaje Collins on Women Radio. She says, my question is not related to today's topic, but is embolization treatment for uterine fibroid, that's UFE, better than surgical removal for a woman aged 35 with 10 big sizes, 12 by 10 centimeter uterine fibroids? Is there any UFE center available in Nigeria? So those are two questions, Dr. Abolaje.
Okay, sorry, I think I lost you there for a bit because I wasn't even hearing anything at all. So I don't know if you can help me.
Okay, all right. So Titi from Abeokuta is asking that is embolization treatment for uterine fibroid, that's UFE, better than surgical removal for a woman aged 35 with 10 big sizes, 12 by 10 centimeter uterine fibroids? And is there any UFE center available in Nigeria? Did you get the question, Doctor?
Yes, I got that question. Now, first off, okay, I do not do surgeries. So to give you a surgical perspective as to which is more efficacious, I cannot really give you a perfect answer on that. But one thing I just want to say is that there are different modalities as to how fibroids can be treated.
Okay.
Doing the embolization, doing the open removal. While some physicians, they actually advocate for open surgeries because you are sure of you are sure that yes, all these fibroids have been removed. During embolization, you're just trying to cut out the blood supply, okay, cut out the blood supply to these fibroids, okay, so that of course they would shrink and all of that, okay. But the thing is that the treatment that will be more effective for such a woman, okay, has to be done with respect to her age. Is she trying to conceive? Is she trying to, because as a fertility physician, this is the way we think about this thing. The way a surgeon would think is different from the way, some other physician would think, because we actually would want to direct the patient, okay, or want to counsel the patient with respect to the secondary motive, okay, or rather, do I say the primary motive now, okay? Yes, or secondary motive rather. Okay. So for that, I do not know if there is any UF, I don't know. But of course, I know there are still some centers. There are some centers that do very advanced surgeries for uterine fibroids. I cannot lay my hands on anyone, so I cannot really direct you in that respect. But as soon as I do, I'm pretty sure we'll be able to reach you through the radio doctor channel, and I'm pretty sure information will pass across to you, but I do not know. I'm pretty sure the lady that just asked that question would have been counseled, and even the right place to go must have already been told to her. So I'm sure she's just looking for an alternative pathway or an alternative place, okay, to go. So I think she should also do her own research, and if there are any further questions, she can of course always ask us, and then we'll be able to advise her in the right direction.
All right, thank you so much, Dr. Boloche. Now, this last message that we can take this morning because of our time is still from Eunice. Remember Eunice who talked about having a series of miscarriages for 10 years now, yes, which you advised that because of her age, since she's 41 years, she should consider IVF. Okay, now, she has come back to say the last miscarriage she had was April, and it was 4 months. Now, sometimes she has 2 to 3 months, of miscarriages.
Okay.
All right. Okay, sometimes she carries for 2 to 3 months, and then the next will miscarry. And she said she has been to the general hospital severally, but they keep telling her to continue with her pregnant care drugs. So she really needs help to, put both, in perspective.
Okay. Perspective. Okay, so just to answer the question now, the pregnant care, these are just prenatal or antenatal supplements and all of that. Okay, they really would not prevent a miscarriage. Now, because of the recurrence of this condition, as case might be, okay, I listed some causes earlier. Okay, the thing is that studies have shown that women who get pregnant, I just want to address the fact that she said she got pregnant last in April, or the last one just happened in April, okay, this year, and she said she's 41. So studies have shown that women who conceive naturally, okay, at the age of 40, from this 40 and above, okay, they stand a 50 to 80% chance of having a spontaneous miscarriage. Yes, that's what studies have shown. 50 to 80, that speaks a lot of volume. Okay, that speaks volume. Okay, so it is very important that she has to know that, okay, egg quality, okay, egg quality, especially for a woman now, I'm not even talking about the man, egg quality, I'm talking about the woman, okay, egg quality actually diminishes, okay, it is greatly reduced in quality, okay, and even the quantity of the eggs rather, okay, is also greatly reduced at this age of 40. Okay, so chances are excellent, okay, that the egg that most likely resulted in that particular pregnancy was defective. Now, when we say egg is defective, it doesn't mean that when you just look at the egg is just outrightly bad. Most likely, there could be already a chromosomal damage of that particular egg. Okay, so usually when that egg results in a pregnancy, the quality of the embryo that will be formed will equally be of bad quality. Such embryos are already, they have a very high chance of resulting in a spontaneous miscarriage. The woman might even decide to admit herself in the hospital for the next 9 months. She would still miscarry because of the quality of the egg that resulted in that pregnancy from the get-go. So this is the reason why I've actually advised her to go over to have IVF done. Because for a woman who is above the age of 40 with a history of recurrent miscarriages, of course, natural conceptions, I don't think she's actually done IVF, because if she has done IVF before and it's also resulted in a miscarriage, she would have also stated it. But so just to speak in the light that, okay, she's not done IVF before. If she goes over to the hospital to get IVF done, of course, she'll be evaluated, scans will be done, ovaries will be scanned, everything. The sperm of the husband will also be evaluated to check, is the sperm okay, motility, morphology, and all of these things. Because even a bad quality sperm fertilizing a good quality egg will result in a bad quality embryo that will ultimately also predispose that woman to having a miscarriage in that particular pregnancy. So these things would have to be done for her, and time is of the essence, because the more she keeps trying, okay, of course, the more she keeps having the recurrent miscarriages.
Okay.
We've had a woman, okay, who also had similar episodes. Of course, she's been getting pregnant since the age of 35. You know, she's been trying, in fact, she's been getting pregnant, and it would always result in a miscarriage. In fact, the last one being that it resulted in a miscarriage at the age of 6 months, thereabout. Okay, so we did all our miscarriage panels, everything, and then we found out that she was having antiphospholipid syndrome, which of course has to be treated in a different way. Okay, medications have to be instituted in the course just before she gets pregnant, or in the course of that pregnancy.
Okay.
She has to take those medications that will help her, you know, to sustain that pregnancy in a different way. Okay, not just using pregnant care and all of that. No, these are just supplements. These will not prevent miscarriage. Other things have to be added. So that's why it's better she goes over to the hospital to get IVF done. Okay, where of course these the medication that is required now to treat whatever autoimmune condition she might have, or whatever problem that might be causing, that might have predisposed her to having these miscarriages. Of course, all of this will be attended to in the course of that IVF evaluation and everything. So,
all right. Thank you so much, Dr. Collins Abolaje, for being on the program today. So how about we do this the next time we have you, the cervical, tubal factor. How about we finish that the next time we have your radio doctor? Because we couldn't even do up to half of that.
Yeah, we couldn't even do it. Yeah, exactly. So that's not a problem. We could pick it up from where we left off.
All right. Thank you so much, Dr. Collins Abolaje, for being a part of our program today.
All right. Thank you for having me.
All right. Do have a great day and enjoy the rest of the week.
All right. You too.
All right, so that's the much we can take this morning on Radio Doctor. Join us tomorrow at 10, I beg your pardon, where we'll definitely get on with the program Radio Doctor. But for women's health, we'll take this up next week, Tuesday, of course, on women's health. Now, let's not forget that today's Radio Doctor on women's health is supported by ACT Foundation. My name is Rose Yusuf Kaiso. Thank you for all of you that called. Please, Vera, I'm still expecting a message from you. Send a message or a WhatsApp message to 070 317 56537. Just stay with us right here on Women Radio WFM 91.7. Good night.
WFM 91.7.